Don't ignore these bleeding symptoms.
So when it comes to bleeding disorders, patients often present to us with, number one, gum bleeding. Yeah, excessive gum bleeding. So when they brush their teeth in the morning, they notice that they have excessive bleeding from the gums. Number two, they can have epistaxis, basically bleeding from the nose. That means without any provocation, they can be just sitting down comfortably and all of a sudden having bleeding from the nose. Third is they can have excessive menstrual bleeding. For example, if their cycles have been regular all this while and all of a sudden they notice that their menstrual bleeding has been increasing over the months. Yeah. And we notice that patients coming with easy bruising or what we call as haematoma, okay, basically having blue-black symptoms on their skin, where on just minimal provocation, they notice that their skin is all having bruises. And the other symptoms that we often do see is patients coming in with bleeding into the joints. Patients first notice that their joints is swollen and very painful. And that after presenting to the hospital, after doing an ultrasound, we notice that there is blood accumulated in their joints. That's called hemarthrosis. Yeah. And that's often commonly associated with haemophilia, especially when associated with very minimal impact injury, as compared to where you have an heavy impact injury that could be related to trauma. But these patients who have haemophilia on just minimal movement, patients coming with bleeding in their large joints. So when we speak about menstrual bleed, we speak about gum bleeds, we speak about easy bruising and so forth, what we're trying to understand here is when this bleeding pattern happens more than what is usual for the patient, and that gives an indication that something is not right, something is not proper, something is wrong with the patient's bleeding system. That should trigger the patient to come to the hospital and get their bloods checked, okay, to see whether they have got any issues with either their platelets, their factors, or their proteins.